Okay, think about your day. From grabbing coffee, using an app, to checking your health records online, digital information, it's just woven into everything, isn't it?
It really is. We're constantly sending it, receiving it, storing it.
Exactly. But what happens when that data, your data, actually goes wrong? It's a question, that probably nags at a lot of us.
hmm
So today, we want to cut through some of that confusion. We're doing a deep dive into two really critical terms that often get mixed up: data breaches and data spills.
Right.
Our mission here is simple: untangle what they are, figure out how they're different, and crucially, why understanding this difference really matters for you.
And it really matters because we're often talking about incredibly sensitive information. Your personally identifiable information, PII, we usually call it.
Yeah, PII.
And your protected health information, PHI. This isn't just, random data points. It's your digital identity, your private health detail.
Wow.
And when this stuff is mishandled, whether someone means to or it's just an accident, the fallout can be serious. For you personally and for the organization supposed to be guarding it.
Totally. So think of this chat as maybe your shortcut to getting genuinely up to speed. We'll share some practical insights, maybe a few surprising facts, all aimed at helping you navigate this complex world of data security a bit better. We're going to break down the differences with clear examples, things you might even recognize from the news. So let's peel back the layers.
Let's do it.
Okay, so when we talk about data breaches, what's the absolute core thing we need to grasp first?
The defining factor, really, is unauthorized access. Simple as that.
Unauthorized access, okay.
It means someone or something that shouldn't have access to sensitive, confidential, or protected information manages to get to it.
Right.
Now, this could be deliberate, like a hacker actively breaking in, exploiting a weakness.
The typical scenario we picture.
Exactly. Or, interestingly, it could even be accidental. Maybe a system is set up wrong, misconfigured, allowing access unintentionally. But the key is, data's been seen or taken by someone without permission, and that often leads to harm.
Okay, let's paint a picture then. Like, imagine a big online store. Let's call them ShopEasy. They store custom info names, emails, credit cards.
Standard stuff.
Right. And we've seen this happen. A hacker finds a weak spot on their website, gets into the customer database, maybe steals 10 million records, PII, like names, emails, credit card details.
A massive haul.
Yeah. And then that hacker sells it on the dark web. Criminals buy it, use it for identity theft, fake purchases. That scenario, that's a data breach, right? Because someone unauthorized actively got in, took sensitive data, including PII, and it was deliberate.
Perfect example. And you mentioned PII there. We hear that term all the time, but maybe we should quickly define what falls under personally identifiable information and why is it such a target.
Good point.
Basically, PII is any piece of information that could be used to identify you specifically.
Like your name?
Your name, obviously. Social security number, email address, phone number, home address, even things like your driver's license number.
Got it.
And when that gets exposed in a breach, the risks are huge. Unauthorized bank transactions, fraudsters opening accounts in your name, targeted phishing scams, it gets nasty fast.
And then there's the other acronym you mentioned, PHI, Protected Health Information.
Right, PHI. That's a specific subset of PII, but it's all health-related.
So medical records.
Exactly.
Yeah.
Medical records, diagnoses, treatments, prescriptions, health insurance details, deeply personal stuff.
And that's where laws like HIPAA come in the U.S.
Precisely. HIPAA exists specifically to protect PHI because it's so sensitive. If PHI gets out, it can lead to discrimination, embarrassment, or even misuse. Imagine a hacker selling patient histories.
Yeah, that's scary.
And it's important to remember, breaches aren't always malicious hackers from outside. Think about this. Maybe a hospital, Healthcare Plus. An employee accidentally emails a spreadsheet. It's full of patient names, social security numbers, diagnoses serious PHI.
Oh no, to the wrong person.
To the wrong person, someone outside the hospital, and maybe that person shares it further, and someone else uses it for blackmail.
Wow.
Now, even though the initial act by the employee was accidental, it's still absolutely a data breach. Sensitive PHI was exposed to unauthorized people, and the harm to patients could be devastating.
So breaches can really happen in a lot of ways then. We've got hacking, human error, like you said.
Right.
What else?
Oh, yeah. Phishing is a big one. Tricking employees into giving up passwords.
You're right.
Malware infections that steal data.
Right.
Insider threats, maybe a disgruntled employee.
Wow.
Even just losing a laptop or phone that isn't properly secured.
Lots of vulnerabilities. And the impact For individuals, it's the identity theft, the financial fraud we talked about.
And the emotional distress, don't underestimate that. Knowing your private info is out there.
True. And for the companies.
Huge financial hits from cleanup and fines, massive damage to their reputation trust is hard to win back, and serious legal trouble for breaking data protection laws.
Okay, so that covers breaches, data being accessed or stolen without permission. But what about that other term, data spills? You said they're different. How do we define those?
Right, data spills, also called data exposure or data leaks. The key here is accidental release or exposure.
Accidental, okay.
So unlike a breach, which often involves someone actively getting in, a spill is usually down to a mistake or an oversight inside the organization. The data just becomes accessible where it shouldn't be.
So it's not necessarily stolen, just left out in the open.
Exactly. It's an exposure, not necessarily a theft by an active intruder at that moment, though, of course, once exposed, it can be accessed or stolen.
That's a really important distinction. Okay, maybe an example for a spill.
Sure. Think about, say, a university. They're storing student records, names, IDs, maybe grades, that's PII, in a cloud storage system.
Pretty common.
Very common. But an employee accidentally sets the permissions for that folder to public. Anyone with the link can see it. Big whoops. Maybe a student stumbles upon it, shares the link on social media, and boom, suddenly anyone can view or download sensitive student data.
Okay, that's a data spill.
Yeah.
Accidental exposure from a mistake, data made accessible to unauthorized people. No hacker broke in initially, but the data is still compromised.
Precisely. And you highlighted why PII in spills is risky. It can get exposed to a really wide audience very quickly, massively increasing the chance of misuse.
And I guess PHI spills are just as bad.
Absolutely. Imagine a small clinic using some online tool for patient appointments, names, phone numbers, maybe even brief notes on medical conditions, so PHI.
Right.
If, due to a simple setup error, that database is just sitting there publicly accessible for a week and someone finds it through a search engine and downloads it, that's a data spill.
Even if nobody hacked anything.
Even if nobody hacked. It was unintentional exposure, but that sensitive health data is now out there compromised.
So what causes these spills typically? You mentioned misconfigured systems.
That's a huge one, especially cloud storage accidentally set to public. Simple human error is another biggie, emailing sensitive data to the wrong list, or using an unsecured platform to share files.
Makes sense.
Also, not properly wiping data off old computers or drives before getting rid of them. Software bugs sometimes. Or just, a lack of good training for employees on how to handle data safely.
And the consequences, even though they're accidental.
They can be just as severe as a breach, honestly.
Yeah.
For individuals, it's privacy violations, potential fraud down the line, a lot of stress.
And for the organization.
A major loss of trust from customers or patients, big legal penalties for not protecting the data properly, plus all the costs of investigating what happened and trying to fix it.
Okay, so if someone listening is trying to get the absolute core difference straight in their head, breach versus spill, how do we boil it down?
It really comes down to intent and action, I think. A data breach is about unauthorized access. Data is actively accessed or stolen, often intentionally. Think, hacker breaking the door down.
Got it. Intrusion.
Right. A data spill is about accidental exposure. Data is made accessible, usually unintentionally due to an error. Think, leaving the door unlocked, or maybe wide open by mistake.
Okay, that helps. Access versus exposure.
Exactly. But the critical takeaway is, despite how they happen, both can lead to really bad outcomes like identity theft, privacy violations, serious legal trouble, especially when your PII or your PHI is involved.
Yeah, and it's interesting how central PII and PHI are to the impact in both cases. You said PII can range from less sensitive, like maybe just a name, to highly sensitive, like a social security number.
Right.
But in either a breach or a spill, criminals can leverage it for identity theft, those targeted phishing attacks, or just straight up financial harm, like that huge Equifax breach people remember.
Oh, yeah, massive. That was a classic breach.
Hackers got PII for, 147 million people? Names, social security numbers, birth dates, addresses, credit card numbers.
The works. And the result was widespread identity theft and just enormous damage, financial and reputational, for Equifax.
And then with PHI, the health information.
That reveals your most personal health stuff. Exposure there, breach or spill, leads not just to potential financial issues, but also discrimination, emotional distress, maybe even social stigma, depending on the information.
Can you give an example of PHI exposure, maybe in a spill?
Sure. There was a case, I think around 2020, involving an unsecured Amazon Web Services bucket, basically cloud storage.
Okay.
A healthcare provider was storing patient records there, names, diagnoses, insurance info, definitely PHI. But due to a simple misconfiguration, it was set to public.
Oh, like the university example, but with health data.
Exactly. Anyone online could potentially access that PHI. That's a textbook data spill. And that accidental exposure led to intense legal scrutiny for violating HIPAA. Plus, they had to notify all the affected patients. Huge blow to patient trust.
Clearly, stopping both breaches and spills needs serious proactive effort. For breaches, what should organizations be focusing on?
For breaches, it's really about strong cyber defenses, good firewalls, encrypting data wherever it sits or travels, keeping software updated to patch those holes hackers exploit.
Makes sense.
But just as important is training employees. They need to spot phishing emails, know how to handle data securely, and strict access controls, making sure only the people who need to see sensitive data can actually get to it.
And having a plan for when things go wrong.
Absolutely critical. A solid incident response plan to contain the damage quickly if a breach does happen.
Okay, and then for spills, which you said often come from internal mistakes,
Yeah.
what are the key prevention measures there?
For spills, yeah, the focus shifts a bit. Secure configurations are paramount, double, triple checking those cloud settings so they're not public by accident.
Right.
Having really clear data handling policies, training employees, check the recipient list before you hit send on that sensitive email. Use approved, secure ways to share files, not just anything.
Seems like common sense, but easy to mess up.
It really is. Regular audits help too, checking systems and logs for weird access patterns, and data minimization's a big one. Only collect and keep the PII or PHI you absolutely need for a specific purpose. And then get rid of it securely when you don't need it anymore. Less data lying around means less data that can be spilled.
That makes a lot of sense. Ultimately, though, both breaches and spills, they carry serious legal consequences, especially with PII and PHI. We hear about regulations like HIPAA and GDPR all the time. What's their role?
They basically put teeth into data protection.
Yeah.
A PII, as we said, is U.S. specific for health information. PHI. It mandates strong protections and requires notifying people if their PHI is compromised. Fines can run into the millions.
And GDPR.
GDPR is the EU's big one, covering PII more broadly. It demands even stricter protections, breach notifications often within just 72 hours, and the fines can be massive, up to 4% of a company's global annual revenue.
Wow.
Yeah. And don't forget state laws in the U.S. too, like California's CC-PAC PRA. They all demand transparency and hold organizations accountable. The legal landscape is tough because the potential harm to people is just so significant.
Okay, so wrapping this up, what does this all mean for you listening right now? We've dug into data breaches, that's the unauthorized, often deliberate access.
Right, the intrusion.
And data spills, the accidental exposure, often from an error or oversight.
The unlocked door.
Yeah. And despite how they start, both can have just devastating impacts if your PII or your PHI gets out there. We're talking identity theft, financial fraud, and real emotional distress.
And it's worth adding a final thought here. This digital world is changing constantly. New threats pop up, new vulnerabilities are found all the time.
It never stands still.
Exactly. Which means vigilance, being careful. It isn't something you do once. It has to be ongoing. It's really crucial for you to think about your own digital footprint, and to actively ask questions about how the services you use are handling your data. Maybe just pause and ask yourself, what are they really doing to protect my information?
That is a critical question for all of us to ask, definitely. Thank you for joining us on this deep dive into the often confusing world of data breaches and spills.
Glad to be here.
We really hope this leaves you feeling a bit more informed, maybe a bit more empowered. Staying aware, being proactive, that's absolutely key to protecting your sensitive data. We encourage you to keep exploring how you can stay safe in this digital age.